could just take a moment here for each of you to introduce yourselves to the group. Why don't we start with Patty?
Hi, good afternoon, everyone. It's great to be here. Thank you, Andy. And my name is Patty McCarthy. I am the Chief Executive Officer at Faces and Voices of Recovery, and also a woman in long-term recovery. So glad to be here with my colleagues on the panel and with all of you today. Thanks.
Thanks, Patty. Dave?
Thanks, Andy. I'm Dave Sheridan. I'm the Executive Director of the National Alliance for Recovery Residences, or NAR. We've been around for about 11 years. We created the set of standards that has been adopted by many states and deliver technical assistance to states, organizations around recovery housing issues, and we're delighted to be part of this panel.
Thanks, Dave. Christina.
Thanks, Andy. Hi, everyone. My name is Christina Canfield. My pronouns are she, her. I am the Executive Director for the Association of Recovery in Higher Education, or ARHE. Super excited to be here today as well. Also, a woman in long-term recovery.
Thanks, Christina. And Roger.
Hi, I'm Roger Oser. I'm the principal of William J. Ostegard Recovery High School, one of the 5 recovery high schools in Massachusetts, and 46 recovery high schools across the country. And I currently serve as the board chair for the Association of Recovery Schools.
Thanks, Roger. So we have a few questions, guiding questions for each of you, and we're going to give each of you a chance to kind of lead us off on this, and then let the others follow on that topic as you would like. And first question we got, I'm going to direct this to Patty. Patty, I know Faces and Voices has been around now over 20 years, I would imagine, and done so much advocacy over the years, especially around recovery community organizations and such, but definitely around leadership and all of those pieces in the recovery movement. Why would you say that your sector is so essential to developing a recovery-ready nation?
Well, first, let me say how exciting this is to actually be having this conversation and to see the White House Office of National Drug Control Policy, the administration, have a section on building a recovery-ready nation. It's historical, and just seeing the president's support, its State of the Union address, and also having a set aside in the recommendations for recovery. It's just it's a historic time, and I'm really thrilled with the leadership that we're seeing at the federal level for all of these agencies that we've heard today. But so Faces and Voices is a voice for people in recovery, family members, and the organizations across the nation that are providing recovery support services. And this group of panelists actually meets regularly on a weekly or monthly basis to collaborate and coordinate and to be together to try to represent recovery support services on a national level. We call ourselves the National Recovery Organization Council, and our focus is really on building an infrastructure, a recovery support infrastructure across the nation that each of our organizations represent. That includes, recovery community organizations, recovery housing, recovery high schools, collegiate recovery programs, alternative peer groups, and others. But with that said, our main focus is to advocate for a recovery support infrastructure within every state and community across the country. So why this is important, why are we involved with it? Well, the common denominator is peers, people with lived experience. We focus on advocacy, policy, leadership development, and capacity building, and our national network of over 175 RCOs that are members of ARCO. We also have CAPRS, which is our Council on Accreditation of Peer Recovery Support Services. So we accredit the organizations that employ peers. But as for RCOs and some of the conversations I've heard today, and just as to react, one of the main things that I'd like to emphasize is that from the early days of the growth of RCOs, which are by definition, community-based nonprofit organizations led and run by the recovery community that do one of any of these things in any combination, but they would be doing advocacy and public awareness for education and training, and also providing peer recovery support services. And the majority of them operate recovery community centers. But we believe that this should be the hub of recovery support services within the communities, and that they should be funded to deploy peers into different parts of the needs in the community, like drug courts or treatment centers or emergency departments. And rather than funding those agencies or the health departments to employ peer workers, our goal is that that becomes the go-to place to find the expertise that makes it sustainable within states. So we have some priorities like, RCOs know what's happening in their communities the best. They are most likely in touch with and serving underserved and marginalized communities. They're trusted community members. They're able to engage people in services. And we've been through various data platforms collecting years of data using the Recovery Capital Assessment and other tools. So our priority is to see that the block grant begins to fund these services in a sustainable way, that there's an infrastructure development plan, which is so nicely laid out by the drug control strategy, that there are equitable services for our BIPOC communities is critical, and that we can eliminate some barriers. So just to name a few, Medicaid reimbursement for peer support and eliminating the requirement that CMS requires clinical supervision for peers. That's a huge barrier. That's something that we can do at the federal level. Making changes to the GIPRA, which grantees for peer work or SAMHSA grants is really finding a huge challenge to be able to reach people and to provide those services when people are not happy with using the current data collection tool. Eliminating the match for some of these grant funds, the B Corps funding. These are real barriers for growing this infrastructure. And, some recommendations, I'll just end, my comments with some recommendations for research, but don't reinvent the wheel in terms of data collection. When different agencies at the federal level are like looking at these data collection, the recovery community has developed these tools already. We are collecting data through different platforms on the outcomes using recovery capital assessments and other quality of life measures. But definitely more research is needed, specifically on the recovery coaching or recovery support itself. There's plenty of research from the mental health world, kind of that what long preceded us as we became formalized in peer support and recovery coaching, but there's not enough research right now on that relationship in the substance use disorder world. Just one more point or two more points is real quick is the all recovery meetings is a form of mutual support that is growing rapidly. And I heard researchers today talk about 12-step meetings or SMART meetings or Celebrate Recovery. But this is something developed by the recovery community that is not focused on any one pathway. Anyone can engage in it. So we need some research on that because all these RCOs are providing those meetings. So that would help us with building that infrastructure. And the last thing I want to mention is that I recently heard the concept or the term of negative recovery capital. And I was really caught by this, my attention was focusing on the people who aren't even at the baseline. They haven't even reached that level yet where they have any recovery capital. We have to start from negative recovery capital. And this is most prevalent when we look at underserved and marginalized communities. So those are my talking points for what we need to do to build a recovery ready nation and why Faces and Voices is involved in this. Thanks.
Thanks, Patty. And I'd like to give each of the other three of you a chance to chime in on that question, very specific to the services you provide. So, Christina, what about colleges? What makes colleges essential?
Yeah, thanks so much for asking, Andy and Patty. Thank you so much because I agree with everything Patty just said. And I think one thing I always look at is the rise in the amount of youth who are seeking recovery services. And so we have more young people who are entering treatment services. We have more people who are accessing those services. We have more young people who are identifying as inner seeking recovery. And what's one thing a lot of us do is we seek higher education. And I think while, collegiate recovery has been more pronounced in traditional four-year institutions, we are seeing a lot of growth like at community colleges. I have a big focus on trade schools. They have a huge part of my heart right now. And so I think this is one of those points of access, for young people in recovery when they're seeking higher education, to make sure they have the supports they need in that environment, which has been described as recovery hostile over the last decade. Tiny bit about me. I found recovery as a college student. I like to say it was one of my junior years. I'm not sure which one it was. But it was not a comfortable environment to find recovery in. And my institution didn't know how to support me other than punitively. And so what happens when we stop using punitive measures on college campuses and we start actually supporting help-seeking behavior and then supporting recovery so they remain in school?
Thanks, Christina. Dave, how about recovery residences? What makes those essential?
Well, I'll just do a little level setting here. You think about those of us, I'm also a person in long-term recovery. In our addictions, we created environments that supported and enabled that lifestyle. And when someone decides to make a change and enter recovery, they're faced with having to do so in that same environment that fed and nurtured their addiction, the people, the circumstances, and that includes housing. So a lot of people who enter recovery are not going to do well if they can't have an alternative place to live that's both safe and recovery supportive. So recovery friendly communities need to also understand that the people that are in these residences are part of our communities. We've run into a lot of issues around discrimination at the local level. And so there's a whole bunch of issues that come together, but basically a recovery house is a place where somebody can anchor their recovery. If they need that kind of a supportive environment, there's no plan B.
Thanks. Thank you very much. And I agree. It's essential finding a supportive living environment. Roger, how about recovery high schools, especially with adolescents?
Yeah, so in our sector for recovery high schools, obviously adolescence is a very specific condition, developmentally, in general, with their social emotional development and how their relationship is to drugs and alcohol. And I think the impact of the pandemic has really raised the importance of our work with our young people on social emotional issues and substance use in a more broader manner, because instead of just being focused on young people who struggle with drugs and alcohol, the pandemic has raised the issue of how important supporting our young people and obviously adult social emotional wellness is and can be, and how we're lacking in providing those supports across the board. And for recovery high schools, if I'm going to focus on one thing in our sector that we really need to leverage more resources for at both the local and the national level, at the local school level, is staffing, right? If we're supposed to, as a recovery high school model, which we have developed, and Dr. Finch is a big part of that, we've developed an accreditation model, a technical assistance model, a data collection model. We've developed all these things and using this to inform program improvement, but to really make it work, you need the people. So if recovery high schools need people who do education, need people to do substance use counseling and mental health counseling, you then need to have a staffing structure that backs that. Instead of always trying to combine different positions and trying to find ways to make things work with limited funding, we need to really be more intentional about advocating for the staffing that we need to serve our young people in the best possible manner. And once again, this isn't limited to just recovery high schools. It's an issue for schools serving young people across the country. But I think the recovery high schools really puts a spotlight and focus on when you don't have the right staffing and structure or you can't support it, it's really hard to sustain a model. And I think it's to the credit of the recovery high schools themselves that the models continue to grow to now 46 schools, and continue to do all the things that we can do at the national level in our association to support schools starting and to improve once they're starting.
That's great. And I will tell you that 46 recovery high schools, that's the most that's ever been in existence at one time ever. So that's tremendous news, Roger. So I'm going to switch to another question. And don't know if each of you have necessarily a response here, but I want you to think about how your sector has evolved over time. I realize there's people participating in this call that are maybe new to this space or new to working with the recovery space, and some that have been doing it for decades. And I think we want to make sure we're continuing to evolve and grow and change, right? And I think when I think about it, I think Dave, I'm going to let you tee this one off. I feel like recovery housing has probably changed quite a bit over time. What would be one thing you'd like to point out about how recovery housing and recovery residences exist today that represents a real movement?
Oh, yeah, this is a great question. First off, recovery housing predates treatment by decades. If you look at Bill White's historical work, it dates back almost to the dawn of the American Republic. For years and years and years, it was the dominant delivery model for recovery services. Again, before there was such a thing as treatment, there was recovery homes, recovery programs that were peer-based, social model, or there were hospital-based programs. And so a lot changed when treatment became our dominant paradigm. Recovery housing, much of it divorced its delivery of comprehensive services and became a more basic model where what was provided was a safe environment plus recovery support plus limited linkages to the community. People were expected to work, go to school, volunteer, be looking for a job. So there was a real narrowing. And then that started to change about 15 years ago. I got involved about 17 years ago and was mentored by one of the real old timers in the recovery housing movement. And what we started to see was a real proliferation in recovery pathways, service bundles, the kinds of things that someone could receive as an adjunct to their recovery housing, and different recovery philosophies, the beginnings of the struggle to try to serve our underserved populations, whether it was racial or ethnic, language, disability, age, sexual minorities. It's been a real struggle because the whole thing's been resource constrained. That most of the capacity today in recovery housing, which currently more people will spend tonight in a recovery house than will spend a night in a treatment center by a factor of its multiples. But most of that is self-pay. And as a result, the system has grown to where the monetary demand has been, which is typically urban areas, working to middle-class neighborhoods, but not poorer neighborhoods. Limited support by the criminal justice system has been a help, but a lot of the models supported that way are not terribly beneficial to recovery. So there's been a lot of barriers financially to the development of more robust services, and that includes staffing. You're talking about workforce. An operator who's financially challenged, who's really constrained by what people can afford versus what it costs just to provide the basic housing service, doesn't have a lot of spare cash flow to invest in staffing and training and professional development. So that's really been lacking. Now, even more recently, there have been a couple of game changers in a positive direction. The Affordable Care Act really changed the environment dramatically for the delivery of services across the board. For the first time when the middle class and working class had access to treatment, which used to have it, a whole different set of relationships between treatment providers and recovery housing providers began to emerge. Not all of them positive. There have been some predatory kinds of relationships that develop that way. But the bottom line is it's provided a lot more opportunities for people to pair clinical services with at least the recovery housing component of community services independently of each other. And that's a real step forward toward the whole idea of a ROSC, or a recovery-ready community. The other game changers, and several people have talked about research and outcomes, research projects like NSTAR, and Dr. Miracle's project that NIDA funded, is beginning to collect basic data on 10,000 plus residences around the country. Two of our state organizations have partnered with their state addiction agencies to provide a comprehensive cloud-based recovery capital assessment system and outcomes measurement system that Dr. Best has pioneered. And so now with state support, we can track not only outcomes, but the demographics of the people we're serving. And that's going to be a real game changer as more states and funding agencies can see the importance of this. I could go on and on about the evolution. I'm sure others have some things to contribute, but there's been a lot of change, but still a lot of challenges.
Thanks, Dave. Anybody else on the panel want to highlight something specific about their sector that they think is important that's evolved over time?
I'll just follow up with that by saying that the RCOs, when they were originally evolved back 20 some years ago with the RCSP grants, that was a way to provide leadership development and advocacy, and they evolved as real leaders in this movement. And today that history has been able to have a key role within state. So that I think that evolution of not just service providers, but developing the capacity of people to be leaders in this role has been really important for RCOs.
Thanks, Patty.
I think I've been a part of the collegiate recovery field for the last 12 years since I was a graduate student and helped start a program at my institution at the time. The sheer growth of the number of programs, I think, is one piece of evolution. And I think too, what's been really beautiful, and even though stressful at times, I think over the last several years, is this evolving conversation about what does recovery look like and who do we serve, especially on college campuses. More in-depth discussions on the role of harm reduction. Where do we fit in the strategic prevention framework that takes place on college campuses? Where do we fit in in that environment, the alcohol and other drug, or AOD environment, on college campuses? And I think a big piece for me is helping shift the view of administrators in the higher education sector that collegiate recovery programs are not just fluff to have on your campus. It's not just something to be like, oh, look, we have this, but it's an integral service that should exist on every campus. And so we're starting to see some of that shift. We're starting to see this be more accepted. Even though that is still a continuing conversation, but just the shift and the types of services collegiate recovery programs offer, and embracing, multiple pathways of recovery.
I think we've all seen shifting populations, and certainly as more of a cascade of care has kind of taken hold versus a very linear continuum of care. People are accessing our services at such different times. We can't assume they've had certain services when they arrive at our doorstep. So that it's such a great point. I'm going to kind of move to one kind of big question here in just a few minutes that we have remaining. You've each kind of mentioned, kind of support that your programs need, and some potential roadblocks to some extent. But I'm curious, as you look forward over the next few years, what do you really think that your sector is going to need to thrive and to continue growing? And Christine, I'm actually going to let you lead this one off, and I want all four of you to reply to this as kind of our final point, because I'm just noticing that we're running close on time here. So Christina, if you could really dream big over the next few years, what would your sector need to really thrive?
I mean, I think I can sum it up in one word, and that's funding. And I don't think that's a secret for anyone here. I think, especially in collegiate recovery, funding is very much restricted to what can the universities provide. And very often that starts as an extremely small budget, maybe like a $5,000 programming budget. If they can fund a staff person, that in and of itself is miraculous. And so what you end up having are staff people who are wearing multiple hats and performing multiple roles on their campuses. And that kind of stunts the growth of collegiate recovery in that environment. And so I think it's just access to funding outside of our institutions. What I have seen over the years, we have a beautiful grant program right now in partnership with the Independence Blue Cross Foundation in Southeastern Pennsylvania, is when we have funding available to schools to get started so that we can then show these outcomes to college administrators, then the colleges step in and hopefully start funding those programs from within. And so we need funding, accessible funding to institutions to be able to do that. And just continued conversations about why it's important to develop these communities.
Thanks, Christina. We have a couple minutes left. Roger, what would you say recovery high
Sure.
schools need to really thrive?
Yeah, and I sort of jumped the gun a little bit in my first answer talking about the importance of staffing. So I just real briefly want to say, I think this is for recovery high schools, but for the entire recovery community, is the importance of this renewed emphasis and focus on diversity, equity, inclusion that we absolutely have to maintain for the high schools, making sure that our schools are open to anyone equally in an equal way. And it really gets to the heart and the soul of what recovery is about. Recovery is about community, about peer support, making sure no one's left behind. And if we aren't looking at our organizations with a very critical eye about how we as organizations hold true to those values of diversity, equity, and inclusion, then we're not upholding some of those core values. And I'd say it was awesome to be able to participate in the process that Faces and Voices led with developing the North Star document on diversity, equity, inclusion. That is a very detailed roadmap for the organizations that signed on about the things we need to do to develop our policies, and then more importantly, accountability. So that's a huge focus for us in the recovery schools.
Thanks, Roger. Dave, how about recovery residences?
Sure, very quickly. New payer models. There needs to be a way to integrate the payment for recovery support services, and particularly recovery housing, more seamlessly and more generously into our healthcare system. We need resources for systems development, for increasing the ability for providers to meet national standards and delivers consistently good services. Outcomes measurement tools, and we need access to capital for expansion. A lot of HUD barriers, a lot of CMS barriers have to be overcome, but with those challenges met, just amazing things could happen.
Thanks, Dave. And bringing us full circle, Patty, what would you say?
I need to advocate for my colleagues here and tell you that without supporting these organizations, they can't support the networks that they support. And as you may or may not know, ARS has no executive director, no staff. This is a volunteer organization. NAR, you guys have done incredible work with very little resources. And I think we need to be seen and recognized as the experts that can support massive numbers. Like, if you think about all the recovery houses, all the RCOs, all the collegiate recovery programs, we're talking about hundreds of organizations. And I also think my vision is that all state agencies have planned out how they're going to support this infrastructure within their own states, the SSAs, and that we can have a roadmap going forward with block grant dollars, that there is a way to support each of these sectors. And lastly, my dream would be that we see a Recovery Ready Communities grant program, similar to the Drug Free Communities grant program, where these organizations can get the funds they need to do community organizing to create recovery ready communities, stigma reduction, environmental policies, all of those things that need to be done in the communities. So that's my wish list, and thanks for asking.
Thanks, Patty, and thanks to all the panelists. Really appreciate it. And I just have to echo all of the hard work that's being done, especially by volunteers in each of these organizations. Can you just imagine how much this movement would move forward if they were all adequately staffed? I hear that kind of going across everybody. That's such a theme. But thanks for all your expertise and all your hard work.